You're listening to a podcast from Cancer.net. This cancer information website is produced by the American Society of Clinical Oncology, known as ASCO, the world's leading professional organization for doctors that care for people with cancer. In today's podcast, we'll discuss the role of oncology social workers in cancer care. This podcast will be led by Iris Fineberg and Penelope Damaskos. Ms. Fineberg is the president of the Association of Oncology Social Work and the Associate Dean for Academic Affairs at Stony Brook University School of Social Welfare. Ms. Damaskos is the president-elect of the Association of Oncology Social Work and the director of the Department of Social Work at Memorial Sloan Kettering Cancer Center. ASCO would like to thank Ms. Fineberg and Ms. Damaskos for discussing this topic.
This is Iris Cohen Fineberg. I'm currently the president of AOSW, the Association of Oncology Social Work. I'm also Associate Dean for Academic Affairs at Stony Brook University in the School of Social Welfare.
This is Penny Damaskos. I am the president-elect for AOSW and director of social work at Memorial Sloan Kettering. Iris, could you describe the role of an oncology social worker?
Sure. The oncology social worker helps patients, families, and caregivers to deal with the experience of having cancer. So what that means is that social workers work with the psychological, the social, the emotional, and the spiritual issues that come up when people are facing serious illness and sometimes end-of-life issues. We work with issues such as referrals, providing resources, helping people deal with the ups and downs of diagnosis and treatment, and helping people to learn how to communicate about things that are pretty difficult sometimes to talk about.
Another thing might be that, so many times people ask oncology social workers, what is it that you do? And it's really important to understand that we can also provide information on resources, on medical and insurance coverage, also all the communication aspects of helping individuals who are undergoing treatment or who have completed treatment and are in survivorship, really help people all along the way. We lead support groups, we lead people to resources, and we really help them manage throughout the disease continuum. The other thing we do is we help our colleagues also manage the stressors of working in oncology. It's pretty well known that it can be pretty stressful, and so we often lead groups or discussion forums so that people can better understand the impact of the work on them.
That's so true, and I think we know that most people have never worked with a social worker necessarily, so it's kind of hard to imagine what it is that social workers do. And in oncology, social workers in particular do a really wide range of interventions. And most oncology social workers are master's degree prepared, and we are skilled to work with a full range of ages. So we're used to working with children and youth and young adults and older adults. And so part of it is that we work with the full range of ages as well as not just the patient but the full family. And we keep in mind that family is really defined by the patient, and a word that we use very, very broadly to include the people who are important to the person who's really going through this cancer experience and coming to the situation as the central person. Now, Penny, when would you say that a patient sees or works with an oncology social worker?
All along the disease continuum. So there are transition points, of course, in treatment. So when people are initially diagnosed or during the initial diagnosis and screening phase, at the point of either surgery or initial chemotherapy treatment. And then another point, kind of a crisis point now we're realizing is at the end of treatment. So when people have completed treatment altogether and they're going into survivorship, so they're no longer on active treatment and they're in the follow-up phase. And that we're learning. We've learned that that's can be another point of anxiety, kind of unexpected anxiety, and sometimes existential reflection for individuals. And then, of course, at the point of if there is recurrence, very much so at end of life and through, palliative care. So oncology social workers can provide, as we said, resources, support. We can help individuals communicate with their loved ones. The role of the caregiver is becoming all the more important as more and more treatments are shifted to the outpatient setting and, in some instances, the home environment. So oncology social workers really help people with adjustments all along the way. Do you have any other thoughts about that?
Well, I think that another piece to just keep in mind is that someone can see an oncology social worker at any point, as you said, but also that it doesn't need to be assumed that once you start, you have to stay. So it might be that you see an oncology social worker for one visit for something specific, whether you're having a rough day and you want to talk to somebody so that you figure out a better way to get through that day or get through that crisis, as you mentioned. But you might work with the oncology social worker over time and meet with them multiple times over the course of the illness, and whether that's steady meetings or just as needed. The model is really very, very flexible based on what the needs are of the person who's ill and all the people involved in that person's life.
You know what you just said is so true, and it reminded me that we're talking about oncology social workers, thinking about them primarily at the treatment centers. That probably reflects my bias where I work, but certainly people can interface or talk with an oncology social worker even if they don't have one at their place where they're getting treatment. There's so many oncology social workers working in the community to help people, again, through counseling and through resources. And many of the services are free. So it's really important to know that if someone is receiving treatment in a private office or in a place where there might not be an oncology social worker, that they can find and get a referral for one in either online, through the telephone, or somewhere in their immediate community.
I think that's so true. And I think that brings us a bit to the question of, do we have any tips to help people better communicate with oncology social workers? Because, first of all, in terms of actually communicating with oncology social workers, one of the things that social workers do is specialize in communication. So I think we worry less about how patients and caregivers communicate with us, because we will be listening to what people need and help the communication along. But the part that I think we do have some tips for people is really how to access us. Because so often people don't even know that there's an oncology social worker available to them either in the institution, as you mentioned, or in the community. And so one of the things that I would say, first of all, is to ask, if you haven't already been introduced to an oncology social worker, just ask at the office or at the clinic or wherever it is that you're getting care. First of all, ask if there's an oncology social worker available to you, because they may not have automatically been presented.
That's right. That's right. I think that is such a good point. Often the business of treatment, can make people not know or recognize that they can have avail themselves to additional supports outside of the immediate treatment team. So and I so agree with your point that one of our skills is to help people identify the points that they need to or would like to better communicate on or about, talking with who do you tell, when do you tell, how do you tell your kids, how do you tell the older people in your lives, what about timing, what are the points that people really need to know, and to kind of figure all that out as you're just starting treatment can be a very, very big task. So
absolutely. I think the other piece in terms of communicating and accessing your oncology social worker is to know that most places will have an oncology social worker, so it's worth asking. And in most cases, care from oncology social workers does not have an additional charge. So if that's a concern, that's usually not something that you need to worry about. But if need be, you can always ask the question. The other piece is to realize that oncology social workers don't necessarily automatically see everyone, and so it's really great to advocate for yourself and say, I'd really like to connect with someone. And even if it's just to know who that person is so that if you need something in the future, you've already met them. It doesn't obligate you in any way to working with them in any particular way. But it's always good to know who's there and is a resource for you. Right. One of the things that oncology social workers do is really help people navigate through hospital systems, navigate through care systems, navigate through transitions from one type of care to another type of care. And it's always really helpful to have someone who can just help you negotiate changes and adjustments.
Mm-hmm. Mm-hmm. Absolutely. And really, just to reiterate that we're there to help individuals in their support system that is completely destabilized by cancer. We're really there to help them find that equilibrium again, and to be able to move forward and through the diagnosis and to reflect on its meaning, but also to be able to return to life in the best and most complete way possible.
Penny, is there anything else that patients should know when they're working with an oncology social worker?
No, I think the key points are, that we're there, that we do exist, that we do have a wide range of skill sets, that we exist oftentimes at the place of treatment centers and also online and in the communities, that we can help individuals, we can help families, and that we can educate people but also help them reflect on the impact cancer can have on the individual and the community that the individual lives in. What about you, Eris? Anything else that you think people should know about oncology social workers?
I think the one piece I want people to know is that we don't only work in situations where there's a huge serious crisis or a true breakdown in what's going on. We're really there for all people who need support in whatever version. So even someone who is really dealing pretty well with what's going on, everyone has rough days, everyone has rough periods or transitions, and so we're there for people who are generally coping really well but could use some help today, let's say, or with a particular question or concern, as well as patients and families who have maybe ongoing issues and concerns that really need more attention. Oncology social workers are really there to work with anyone in need at any point in any form. And so to keep in mind that we're there for the full range of needs, not just when someone feels like things are really falling apart.
Thank you, Ms. Fineberg and Ms. Damaskos. More information on the role of oncology social workers in cancer care can be found at www.cancer.net. Cancer.net is supported by the Conquer Cancer Foundation, which is working to create a world free from the fear of cancer by funding breakthrough research, sharing knowledge with physicians and patients worldwide, and supporting initiatives to ensure that all people have access to high-quality cancer care. Thank you for listening to this Cancer.net podcast.